Hey guys, I'm Siobhan, an internal medicine and rheumatology specialist. Today, let's talk about what hair loss says about your health. Is it just normal aging, or could it be something more sinister? Let's get into it.
This video is made for educational purposes only and should not be viewed as medical advice. Speak to your doctor if you have any concerns about your health.
Alopecia areata. It's a condition where the immune system mistakenly attacks the hair follicles. It may sound familiar to you because it's the condition that Jada Smith has been suffering with, and it was heavily discussed with Will Smith's Oscar slap. And it's actually relatively common. About 1 in 50 people will experience it at some point in their life, and it can happen at any age. This is the classic way that it shows up: a round, smooth spot of hair loss. This patient was treated with injections of steroids directly in the scalp to calm down the immune system. After just 3 injections, the spot was gone. But in severe cases, these patches can spread to the entire scalp. And that's what happened to this 33-year-old man who very quickly and suddenly went completely bald. He was treated with high-dose prednisone to suppress his immune system, and the results were truly amazing. In just 6 months, he had a full head of hair back. Okay, discoid lupus. This is an autoimmune disease that affects the skin. Unlike alopecia areata, where the scalp looks normal, discoid lupus causes massive inflammation, which leads to scarring and destruction of the hair follicle. And unfortunately, that often leads to permanent hair loss. One famous example is musician Seal, who has distinct scars on his cheeks caused by the disease. Now, discoid lupus usually only affects the skin, and that's quite different than systemic lupus, the diagnosis that Selena Gomez has been open about, where internal organs are usually involved. Anytime there's a major shock to your system, like an infection, surgery, childbirth, or even a crash diet, your hair follicles can be affected. And when the shock is severe enough, you can shed a lot of hair. This is a woman who noticed her hair was thinning 2 months after a COVID-19 infection. You might be wondering, why such a long delay? Well, it has to do with the life cycle of a hair. So a hair normally grows for 4 years, then enters a resting phase before falling out a few months later. Every hair on your head goes through this process and falls out at some point. But because it doesn't all happen at the same time, you barely notice it. But if there's a large shock to the system, a whole bunch of hairs go into that resting phase at the same time. And then it's just a matter of months before they all fall out. This is called telogen effluvium. Luckily, the new hairs are in the process of growing, so it's temporary, but it takes time. So how is it diagnosed? Well, there's an easy test called the hair pull test, and it's what you probably think. You take about 50 to 60 hairs, and you pull down to see if any come out. Ah, there you go. You've got a hair that came out here. A couple, no problem. But if it's more than 10% of the hairs that come out, this is a positive test. And while you're doing tests on yourself, you can also check your nails too, because nails also get affected by a big shock to the system. You can see horizontal ridges called Bowes lines. And I talk about this more in a separate video where we discuss what your nails say about your health. So I'll pin a link in the comment section in case you want to check that out after this video. Sometimes it's not so much a shock to the system that causes hair loss, but a shock directly to the scalp. A 41-year-old woman experienced a severe reaction the day after dyeing her hair. Her scalp itched, her face swelled, and she started losing her hair. This is what her hair looked like when she saw her dermatologist. Then 4 months later, she'd lost almost all of her hair. She had patch testing done to look for any allergies, and it showed she was extremely allergic to a common chemical in permanent dyes called PPD. Just like in the last case, the shock of the allergic reaction put her hair follicles in this resting phase, and a few months later, all of her hair had fallen out. Don't worry, it wasn't permanent. She was treated with steroids to calm down the allergic reaction, and then she had a full recovery. Okay, now on to syphilis. This 38-year-old man developed a mysterious rash that went away on its own. Over the next 3 months, his hair started falling out in this unusual moth-eaten pattern. So he went to his doctor and he was diagnosed with syphilis, a sexually transmitted infection that's been making a comeback recently. A fun fact about syphilis: we often call it the great pretender because it can cause almost any symptom and can mimic other diseases. Fortunately, syphilis is curable. So after receiving penicillin, his hair was back to normal 3 months later. Okay, next let's talk about biotin deficiency. So this woman presented with a flaky scalp, hair loss, and low biotin levels in her blood work. She started a supplement and really improved after just 3 months. But a true biotin deficiency is actually quite rare, and that's because the bacteria in our gut produce it, and we get it from things like soybeans, liver, and yeast. So how does it happen then? Well, in healthy people with a balanced diet, it's extremely rare. But one way that you can become deficient is by eating too many raw egg whites. That's because they contain avidin, which binds biotin blocking its absorption. So just cook your eggs and you'll be okay. But severe cases of biotin deficiency can be far more dramatic. Here's a 3-year-old boy who has a genetic condition that prevents him from metabolizing biotin. He presented with a rash around his mouth, hair thinning, and problems with speech and movement. Amazingly, after just 6 weeks of high-dose biotin, he had a full head of hair, his rash was gone, and he was walking and talking like a pro. So clearly, biotin is important. But if you aren't deficient, taking extra isn't going to help with hair loss. On the bright side, it can be really helpful for brittle nails, regardless of your biotin status. Okay, on to iron deficiency anemia. Now, this woman developed severe iron deficiency because of her heavy periods. Gradually over time, she became more exhausted. She became short of breath just walking up the stairs, and her hair was progressively getting thinner. When she went to the doctor, her hemoglobin was shockingly low, at 48 grams per liter. Now, for American viewers out there, that's 4.8 grams per deciliter. She was treated with a blood transfusion and intravenous iron. Her hemoglobin then increased from 48 to 140. Not only did her hair grow back, but she felt better than she had in years. For this next one, if you look closely at this patch of hair loss, you'll see hairs at different stages of regrowth. This 19-year-old woman was diagnosed with trichotillomania, a psychological condition where a person feels the irresistible urge to repeatedly pull out their hair. Often, this goes along with anxiety, depression, and other obsessive-compulsive symptoms. It can be difficult to treat, but this woman was able to overcome it with the right supports. Another way your hair can get pulled out is with your hairstyle. Traction alopecia is anything that pulls your hair too tight for too long. So if you notice this happening, it may be the universe telling you it's time for a change. So let your hair down and your scalp will thank you. Hypothyroidism and zinc deficiency. Over 2 months, this 28-year-old woman developed generalized hair loss, as well as a puffy face and really dry skin. Her doctors ran blood work and diagnosed her with hypothyroidism. Her body wasn't producing enough thyroid hormone. This is a classic cause of hair loss, weight gain, dry skin, and fatigue. Most people respond quickly after starting the right medication, but surprisingly, she didn't improve. So her doctors continued to search for another cause, and they found low zinc levels in her blood. This explained a lot. It can cause a rash like this, it can cause hair loss starting at the back of the scalp, and we know that you need thyroid hormone to absorb zinc from your food. Just look at this transformation after only 4 months of treatment. In medicine, we often see overlapping conditions, and in this case, both hypothyroidism and zinc deficiency contributed to her hair loss. So how can you prevent zinc deficiency? Oysters are surprisingly packed full of zinc, but you can also get it from other types of meats and legumes. But for all the vegetarians and vegans watching, you're still at risk of a deficiency even if you're eating lots of legumes because they contain phytates, which block the absorption of zinc. Pregnancy, breastfeeding, and chronic diseases can also put you at risk. Next, let's talk about medications. So everybody knows that chemotherapy can cause hair loss, but other common medications can too, like Accutane, lithium, or anti-seizure medications. This woman took valproic acid, a common anti-seizure medication, for 3 years, slowly increasing the dose over time. She started losing so much hair that she was clogging the drain after each shower. But this was all reversible. This is her just 3 months after stopping the medication. So that brings us to female pattern hair loss. I'm so sorry, ladies, I hate to tell you, it's not just men. And it's way more common than you might think. At least 40% of women will be affected before the age of 50. The good news is that we don't have to worry about a receding hairline. Instead, we get progressive thinning on the top of the head. I've definitely had my moments where I was looking at my brush thinking, oh no, it's happening. But I want to remind you that it's completely normal to lose up to 100 hairs per day, and with long hair, that can look like a lot. Most of the time, this form of hair loss isn't related to an underlying condition, but when it is, it's usually polycystic ovarian syndrome. Women with this condition have higher levels of testosterone, irregular periods, infertility, and acne. Research is ongoing to better understand female pattern hair loss and how it differs from the male version. This way, we can develop more targeted treatment options for women. Okay, let's switch over to the male version, male pattern hair loss. It's also called androgenic alopecia to show the complex relationship between androgens, the male hormones, and genetics. But the truth is out, guys, you can't blame your mom for your hair genes. It's a common myth. Hair loss genes actually come from both sides of the family. So, what does this tell you about your health? There's a link between heart disease and male pattern hair loss, especially if the hair loss starts before the age of 40. Since we can't change our genes, at least not yet anyway, consider it as a reminder to focus on the risk factors that you do have control over, like smoking, diet, and exercise. On a more positive note, there are effective treatment options both for men and women with pattern hair loss, and they're usually more effective if they're started early, so see your doctor at the first signs of hair loss. So the bottom line is, if you're having hair loss, keep track of any other symptoms you're having because they could be related, take pictures to track changes, and see your doctor to help make the diagnosis. The health of your hair is closely linked to the health of your nails, so if you're wondering what your nails say about your health, then check out this video over here. And if you're curious about other hair conditions like brittle hair, flaky scalp, or extra hair growth, then you're in luck because I'm creating that video right now. Be sure to subscribe so you don't miss it, and that way I'll see you in the next video. So, bye for now.